Hey, Margie here. Did you know that food sensitivities could be a root cause of osteoporosis, arthritis, skin conditions, and so much more? Well, today, this is the topic that we're going to delve into with our very special guest, Dr. Tiffany Caplan. And Dr. Tiffany is an international speaker and best-selling author. She's a certified functional medicine practitioner and board certified in integrative medicine by the American Association of Integrative Medicine. She is an active member and certified practitioner of the prestigious Institute for Functional Medicine. She is the co-owner of Kaplan Health Institute and Central Coast Center for Integrative Health, two healthcare practices seeing patients from around the world with chronic health conditions and helping them regain their health naturally and sustainably. She is passionate about her work as she started out as a patient herself, dealing with her own health issues, and is thankful to be able to use her firsthand experience to help others regain hope, health, and resilience. In this episode, we talk about food sensitivities and how they can negatively impact your bones and overall health. We also discuss stomach acid, leaky gut, and Dr. Tiffany goes through her step-by-step approach to treating patients with food sensitivities. So lots of great information. Stay tuned. Welcome, Dr. Tiffany. I'm just really excited to be here with you. I love this topic, and I think it has such an important, there's just so many health consequences, and I think it can help a lot of people because it's just not something that's talked about as one of the first things that everybody needs to do. So welcome, welcome.
Thank you. Thank you, guys. This is such an important topic. It's like important for anybody that eats, really. So anybody listening.
I guess that's all of us. Well, I always like to know why people are so passionate and what got you into this. So why don't you tell us how your story with food sensitivities and how you got to be doing what you do today?
Yeah, it was definitely not on my radar when I first started having like brain fog and depression and anxiety and stuff. I had no idea. I thought I was eating pretty healthy. I didn't have any gut symptoms or anything. But I went to see a functional medicine doctor when conventional medicines and stuff weren't helping. And she was like, it's what you're eating, it's your gut, that's what's causing this depression, that's what's causing this brain fog. And she put me on an elimination diet, which was like one of the hardest things I've ever done at that point in my life. And oh my gosh, in weeks I was feeling so much better. Like, I did not realize how bad I was feeling until I started feeling better. And it just really clicked in my mind, like, oh my gosh, the foods that I'm eating are really telling my body how to act or how to function. And I was not functioning like I should because my body wasn't getting what it needs and it was reacting to the foods I was eating. So it just made a lot of sense. And that's how I actually became a practitioner myself. It just made so much sense going the functional medicine route. And now I just see that all the time. Every patient that I meet with, I ask them what they eat. That's one of the first questions that we talk about because it really matters so much.
Oh, that's so interesting. It's funny how we get to be doing what we're doing because we ourselves suffered. But then there's a nice part about that is that then you can help so many people because of your story as well.
Right.
So let's talk about this because traditionally people will say, oh, it might have an impact, it might not. But we know that that's not the case, that it can have a huge impact. So what's the first, well, first of all, with the bones, because a lot of people listening, have issues with bone health and osteoporosis. There's a huge correlation. And I don't think people realize that they actually have a whole field called osteoimmunology. It's a connection between our immune system and our bone health. And they found with autoimmune, when people are inflamed, it can significantly reduce, really cause problems with their bones and really cause reduction in bone density. So it's something that can affect every area of your body. And so I think it's just, it's just so interesting. And even we'll go into the specifics, but gluten has been shown to really affect the bones, and then really can also lead to bone loss. So this impacts everybody. So let's start from the beginning. So someone comes in and we're not sure if they have food sensitivities. What's the first step?
Well, the first step is always just an elimination diet process. That's really the gold standard. It's something that really you can do on your own. You don't have to be working with anybody, but you eliminate the foods that are the common culprits, which we can kind of get into. Some of the things that are commonly inflammatory, commonly an immune reaction, like a sensitivity or an intolerance, and you cut those out for a period of 21 days, because when your body's having an immune reaction to a food, that's the half-life of the reaction. So it lasts, it's not just like, oh, in and out of your system that day that you eat it. That immune reaction, that inflammation process that happens actually lasts on average 21 days after exposure. So we cut out the foods that we think could be problems for that person, whatever that may be, like the grains, the dairy, the sugar, and nightshades. And we keep them out for 21 days, and then we reintroduce all those foods back in, because if we're not reacting to a food, we need to be eating it. You know, nutrients and diversity in our diet is very important. So we go through just figuring out what are the foods that the body is actually having a abnormal reaction to, or that's causing symptoms or causing inflammation. And we just kind of go through that little process first before we even think about doing any other type of testing, like blood testing, which is also something that gets run, you know, commonly for food sensitivities.
And so do you do it based on someone's symptoms, or do you do it on the typical triggers?
We usually start with the typical triggers. If they have not changed their diet at all before, they're eating the SAD diet, the standard American diet. We usually will just cut out the main things, because the grains, the dairy, the sugar, the nightshades are so common in the standard American diet. It's like the majority of what people are eating on a daily basis. And we know that the more exposure that you get to something, the more likely it's going to be a reaction, right? So it's just like cutting out the things that are typically more problematic first. Now, if somebody's come to us and they're like, well, I've already done an AIP diet, I've already done the elimination diet, and they're still kind of struggling, that's when we can do a food journal and figure out, are there other things that we need to eliminate? Maybe there's like nut sensitivities or legumes, or, you know, something else that we can do at a process of eliminating and figuring it out. But usually it's the common culprits that most people are having the biggest problem with.
And do you see out of those 4 that you mentioned that some are absolutely the biggest triggers, or?
Yes. I mean, it does vary, of course, person to person. It can vary even with the type of, like I work with a lot of autoimmune patients. So if they have more like rheumatological conditions, sometimes nightshades are a bigger issue than for somebody that doesn't have something like that. But it's usually the gluten containing grains. Even a lot of times the non-gluten containing grains, like the corn or the rice, or things that maybe were common in their diet. The dairy products, and then of course sugar across the board is not good for anybody. So that one definitely needs to be out.
And then the nightshades, you said also.
Yeah.
But that's not the highest culprit that you see.
For some people it can be, but gluten and dairy are really at the top of the list.
Yeah, that's what I see as well. I just see, and the interesting thing, people are like, well, I cut it back, but that's not, can you explain why that's not good enough? It has to be 100%.
Yeah, so that's where a lot of people will be like, well, I tried to get rid of it, or I was, you know, I cut most of it out, or maybe they just went gluten-free, but they didn't do the grain-free, they didn't do the dairy-free, and they're still having a lot of the symptoms. Well, one, it could be there's cross-reactive foods. So you could be reacting to, like, say 5 different foods, and you cut out one of them, you don't really notice a difference. Or if you've kind of cut it out, but not really, remember that half-life of the food reaction is 23 or 21 to 23 days after exposure. So you could be eating something like once a month, and it still could be constantly keeping that inflammation going. So you don't really notice that it's gone, right? Because it's not.
And I think that's an interesting point, because people think it's like an allergy, you know, someone having an anaphylactic reaction, and then, you know, where this isn't, it's so very different. You want to explain how this is so different?
Yeah, and it also could be very subtle, and that's something else that makes it a little confusing for people to see, because they're looking for a major reaction. They're looking for like gut bloating or diarrhea or something just obvious that sometimes it's not. When you have an allergy response, like you're saying, it's a shorter lived, it's more severe, tends to be more obvious. So that lasts about 2 to 3 days. Sensitivity reaction is that delayed response. So symptoms can show up hours to days to a week after exposure to something. And it lingers, that inflammation lingers, and it continues for 21 days after you've eaten it, after you've consumed it. And the symptoms could be brain fog, energy issues, sleep problems, joint pain, skin rashes, you name it. It doesn't have to be like an obvious gut reaction, which a lot of people are looking for a gut reaction when they're looking at food reactions, right? And then there's also intolerances, which is something else that we kind of go into in the summit as well. Allergies, sensitivities, and intolerances, different types of reactions. Intolerances are not actually an immune reaction. It's a problem digesting something, but you can also have a problem with a food because it's not being broken down well, right? So there's different ways that the immune system or the body can react to foods. And sometimes it's not very obvious, which makes it hard until you kind of go through that process of eliminating all the right things and then adding them back in and really watching for any symptoms to return.
Okay, so if someone's listening and they want to try this, it's the new year, and this is something which is so surprising to me. It's not typically told, well, why don't you? And I love what Dr. Tom O'Brien says, you have to get rid of the fire.
Mm-hmm.
You have to put out the fire before you can start healing, and getting rid of the gasoline, or whenever you're eating this food, you're putting the gasoline on it. And so so you're saying basically try to just eliminate this and then see how you feel in 21 days, but 100%, which is sort of hard for people. I think that's what's good about your summit, I guess. You're going to really, we can talk about that later, you're going to give them lots of different tips on that.
Yeah, no, I mean, that's the hardest thing for people to do, is to stick to something like that, especially when they don't understand it. And that's why it's so important. And that's why we're trying to get the message out of what food sensitivities are, why they matter, helping people understand that whole concept and what it's actually doing to the body. And I think that's really motivating for people too, to understand why they need to be doing something. And then also during the summit too, we have people that are talking about like how to make changes, how to make things make changes that are maintainable, that are sustainable, that, are habits and not just a short-term dietary approach, So yeah, we had interviewed a bunch of people to talk about like the mental, emotional part of making changes with food too, because it's super important. It gets overlooked. And even, in the medical field, like you said, there a lot of times they don't even consider that food could be a problem. There's so many patients that we see that go to their like gastroenterologist, they have an IBS, they have Crohn's or diverticulitis or something, and their doctor's like, oh, food doesn't matter. It doesn't matter what you eat. It's like, yes, it does. It's kind of crazy.
It really is crazy. And I personally had this experience with my husband, who's a physician, who had some issues and nobody could figure out. And he had autoimmune, he was losing weight, he was really sick, coughing, didn't have any stomach issues, but antibiotics, they kept putting him on, got so sick. But it ended up being that he probably had molecular mimicry and leaky gut from the antibiotics. Gluten comes in and then the body attacks. And so at the end of the day, after seeing so many people, so much money, it ended up that he tested, and sure enough, he had a gluten issue and he got better. But the thing is, it's just unbelievable to me still to this day. It's overlooked, and it can it's such a cause of inflammation. And as you said, people don't know, because people, I think, and everybody listening, and you can attest to this, Dr. Tiffany, because you don't have to live with these things. People think, oh, I'm getting older. Brain fog's typical, no big deal. Or, oh, I have bloating, or yeah, I have eczema. Not a problem. So what's your thought on that?
Yeah, no, that's a great point. I mean, I always tell people that symptoms are never normal. Symptoms are literally just our body's like indicator light that there's something going on that we need to pay attention to. And it really doesn't matter how benign the symptom is either. Like, oh, I have some skin rash, right? Oh, I'm gaining weight. Oh, I'm just tired, People kind of brush it off as, oh, it's normal. I'm just aging. It's just kind of expected, right? With symptoms though, if we can just kind of tune into our body, it's telling us that there's a dysfunction. Even like having inflammation in the body. Well, what is inflammation? Inflammation is actually a natural process that the body has to be able to fix and repair itself and clean out debris and everything. But when it becomes chronic and it starts to present as symptoms, there's always a reason behind it, right? There's always like a mechanism or a dysfunction or something that's causing it. And that's kind of what we uncover in more the functional medicine route, is the root of why that inflammation is there, right? So food could be one of the biggest triggers to that.
And that's why I love functional medicine, because it's not as, oh, you have eczema, let's put some hydrocortisone cream on it. Because then you're covering up the symptom. There's something underneath going on.
Yeah.
And okay, so now let's talk about, when would you do testing and what type of testing do you do typically?
Yeah, so testing is always an interesting topic because there are a bunch of labs that do food sensitivity tests. But the problem is there's not just one marker that you can look at to really determine if you're going to have a food react or if there's a food reaction happening. So there's a couple of factors. One, we can look at, there's IgE testing, that's allergy response, right? So a lot of times people go to their doctor and it's like, oh, we tested for foods and I don't have any allergies, but they've been looking at an allergy response in IgE and not an IgG and IgA, which is a sensitivity response, that delayed response. So there's different immunoglobulins that can be looked at, the IgE for allergies, the IgG, the IgA for sensitivities, more the delayed reactions that can happen. And a lot of tests will just test like one of those different things. But what if you have, they're only testing IgG, but you have an IgA reaction? It's not going to show up as a positive, right? Or on the other side of the coin too, when you have leaky gut, which really you can't be developing food sensitivities, food reactions without leaky gut. When you have leaky gut, the chance that your immunoglobulins or your immune system is going to be upregulated against everything that you're getting exposed to on a regular basis is much higher. So you could do a panel and see everything lit up and it says, well, now you can't eat anything, right? Because it's just everything is positive. And so we find that usually doing an elimination process first is what helps us really determine the main culprits. And then if we have questions and we still feel like we're not quite figuring out what those little things are, because maybe it's the additives in the food that people are reacting to, the dyes or the gums or the spices or something, which sometimes those little things are hard to figure out. Then we can do more of the blood testing. But I like to start with a clean slate first, do an elimination process, see what we can figure out and determine from that, because even that in itself lowers the inflammation, helps the gut, not be so overreactive to the foods you're eating. So we do use some labs that will test for like the IgG, the IgA, like the different types of immune reactions, test the food in a cooked form, test it in a raw form, right? Like different ways that the body can be reacting to it. So there's some tests that we will run, but usually it's a secondary step.
Oh, that's great. So in terms of, I think we said a couple of really important points. So if you went to your allergist and they did all the tests and they said, no problem with wheat, no problem with milk, there's other pathways. They're only looking at one. So I think that's just important for people to know. You can't rule out that wheat is not a problem just because that one test. And I think oftentimes people do that. They're like, no, I've had that tested. I have no problem. So I think, I think it's tough. I think that the elimination, if you're listening and saying, and I can't even tell you from my practice working with people with osteoporosis and bone issues, how many people, the biggest one I see, I'm not saying this is the only one. I mean, I see a couple things, but all of them are problems if you're not absorbing. If they're causing problems with absorbing and we're not getting our nutrients, that's going to affect our bones. But gluten in particular, there's such a big correlation. And typically, a lot of times people will just test for celiac, but they won't test. And that's such a problem because that's such a small percentage of people that have celiac. And they know that that's related to osteoporosis, but all the people that don't with celiac, you have to have complete atrophy of the villi in the small intestines. But a lot of times you have other issues to gluten that are not celiac. And so that's what I typically see.
Yeah, well, in celiac, it has to be bad enough to be able to call it celiac, that if it's not quite bad enough yet, they won't call it that, right? So they'll be like, oh, you're fine. Just continue to eat gluten, continue to eat wheat until it gets bad enough, and then we'll tell you not to. But yeah, there's the non-gluten or non-celiac gluten sensitivity that is way more common. And we know that gluten can cause leaky gut. And we know how inflammatory and cross-reactive, and there's, the mimicry, like you were mentioning earlier, to self tissue that can come from that. And then also with the testing for gluten, you go to your doctor and be like, oh, can you test me for gluten sensitivity? And they might do a blood test that's an IgG marker for like one of the gliadin, there's like 30 something gliadin forms of wheat. and they'll test one of them, and then they'll be like, oh no, see, that one was negative, so you're fine. But it doesn't mean that that was not an issue, right? So yeah, different ways to look at it.
So 2 questions, just for people listening, because everybody's heard leaky gut, but it's always good to hear different explanation. I mean, it's one explanation, but why don't you just tell for people listening saying, well, I don't know if I have leaky gut. So can you just explain that a little bit?
Yeah. So our gut barrier is really what protects us from our outside world. As things are coming through our gut, like food or bacteria or toxins that we're getting exposed to and we're swallowing, right? That cell layer thick is what keeps it from getting straight into our bloodstream. So when we have a good, healthy gut barrier, we have like this wall, nice tight junctions between all the cells, and it keeps things from getting straight in. When we have inflammation, or we have like maybe a reaction to gluten, it's causing destruction of the cells, of the cell barriers, those junctions between the cells. Then we have what's called too much permeability. It becomes leaky. Things can get through where they were supposed to get through before. So now if we think about like what's happening in our small intestine is we're getting food into our gut, it has to be broken down small enough into the nutrients to be able to get absorbed by our gut lining. And if the food is getting to the cells before it's fully digested and it's able to get into our bloodstream, now it looks foreign to our body. And so our immune system can be like, well, wait a minute, that's not supposed to be here. I don't know what that is, right? Because it doesn't look like it's supposed to. It's not been broken down well. Now you can have an immune reaction to that food. Could be broccoli, banana, gluten, dairy, it doesn't matter. Like you can have a reaction to something because you have exposure, your immune system's getting exposure to it when it normally shouldn't. So that's really where food sensitivities start, is in that gut lining. When that gut lining is not healthy enough, that barrier is breached, and it allows our immune system to start getting exposed to things that it normally shouldn't.
And what are some of the things that break down that barrier?
Stress. But stress is, could be mental, emotional, but it's physiological, it's chemical. So having like a food reaction is a type of a chemical stress in the body, or not making enough digestive enzymes can be a stress in the body, or just having a lack of nutrients, right? Because when you're not absorbing the nutrients well, your immune system needs it to function, your cells need it to repair themselves, right? We need to have nutrients to put the inflammation out. So stress comes in a bunch of different forms, and that can create that destruction of the barrier, or the inflammation that causes the destruction of that barrier. Just like nutrient deficiencies kind of come in there. I don't know what else you see commonly, but that's pretty much everything can be linked back to stress or inflammation, right?
What about certain medications? Are there certain, what I see sometimes is, and this, I see this a lot actually, people who were athletes and like lived on Advil, or people, who had done a lot of antibiotics, certain courses of antibiotics. Are there any other ones that you typically see?
Yeah, something else is a lot of people are on acid blocking medications, the PPIs, right? So that lowers your stomach acid, or the ability for your stomach to make acid, so things don't get broken down as effectively as they should. So that also causes food sensitivities alone, right? You're not breaking things down and it gets into the gut not digested. That's going to contribute to your immune system overreacting. But yeah, I think acid blocking medications is a big one.
And that's such a big deal also with osteoporosis. They've shown that the reduction in stomach acid has, there's a huge relationship between people on the proton pump inhibitors and bone loss. And actually, there's a Dr. Wright who he actually did the test to measure stomach acid, and he found 90% of his osteoporosis patients had reduced stomach acid. So it's such an important point.
Well, and a lot of people too will confuse it with having too much acid, because the symptom of not making enough stomach acid is acid reflux. So people will be having acid reflux thinking they're making too much acid, but really if they're not making enough, then that's what causes the food to sit in the stomach longer, to ferment, to not close the top of the stomach, that valve that needs acid to be able to close it. If you're not making enough stomach acid, like those factors are then going to actually cause a reflux to happen. So people that are having acid reflux problems, heartburn, indigestion, or even signs like postnasal drip, that's actually a common symptom of a silent reflux. Those are all indicators that you're not making enough stomach acid. So the majority of the time, that's what I see is actually causing people to go on those acid blocking medications because they're thinking they have too much acid, but it's actually not enough, and it's just compounding the problem.
So let's go over this again, because this is something that people are always so confused about. And it's so important because traditionally you have acid reflux, you're given something to reduce the acid so you don't have the symptoms. And granted, if you have an ulcer, there are times when you do need to reduce the ulcer, but for the most part, just explain this again, just so everybody listens to this. It's not that you have too much acid. It's that the real underlying cause. Just go over it one more time, because this is such an important point, because people live on, I see this all the time, they live on this medication and they think they're helping themselves, but in the long run, they may be helping symptoms for a very short time, right? In the long run, they're doing so. So just say one more time so people absorb this, because it's really a key point. Do you agree with me that it's just not something that the average person knows about?
Right. Yeah. No, most people have no idea when I tell them, but
Right.
it's also really important too with the medication. Like if you look at the insert that comes with any of those PPI medications, it says you shouldn't be taking it more than 6 to 8 weeks. That's all that is expected for it to be used, and people are on it for years, right? But yeah, when you don't make enough stomach acid, the food sits in your stomach longer, and so it ferments, and it actually causes then you to start trying to make more acid. And if you don't produce enough acid to begin with, that valve at the top of the stomach, which is supposed to close when food gets in there so your stomach can digest it, doesn't close. And so you actually get this reflux of acid going back up the esophagus, which produces those symptoms of too much acid. But then again, it's, breaking that, you're not breaking the food down, it's getting into the gut, not digested, you're not going to absorb the nutrients from it. So then kind of feed into the whole osteoporosis thing too, right? Lack of nutrients, causing leaky gut, causing you to react to the foods, causing the inflammation. So it's just kind of this like trickle down effect. But the stomach acid is so important, and most people are actually deficient versus making too much of it.
Oh, thank you. So what do you do then? So someone is deficient, or do you test them? What's your protocol, or what do you typically, not protocol, but what do you typically do about the stomach acid?
Yeah, there's actually some blood markers, like there's a total protein marker that we look at on blood work. And if it's low or even too high, it can indicate that you're not making enough stomach acid. But we will typically use it's called hydrochloric acid, betaine HCl. It's like stomach acid in a capsule, basically. And we have people take that with their meal, and we have them kind of start, you take one capsule with your meal. If you don't feel anything, you're deficient and you're actually needing it, right? It's like giving your body what it needs. And then you kind of keep increasing the dose until you actually get some heartburn with it. So that could be like taking 3 or 4 capsules of the HCl before you get that feeling like, okay, now there's too much acid, and then you kind of back it off. But it's really important that you supplement with that until you can produce it on your own. So we always use supplements as like a tool to kind of help aid the body in fixing that. And so you may not need to take HCl as a supplement for a while until you can kind of start producing it on your own, and then you'll get to the point you don't need it anymore. But it's something that can be fixed. You just need to know that it's, happening to begin with, and not be doing a bunch of Tums or PPIs to shut it down even more.
And do you recommend people work with their practitioner on this?
Yeah, yes.
Yeah, I think that's the absolute safest. There are some other things, right, they can do to increase stomach acid without the betaine HCl. There's anything else that you recommend?
Yeah, well, actually getting to the root of why they're not making the stomach acid in the first place, right? So it could be like an infection. It could be even low thyroid, like having something that seems totally unconnected. Like a lot of my hypothyroid Hashimoto's patients don't produce enough stomach acid, because you think of, okay, the stomach is just like every other organ in the body. It's made up of a bunch of cells. Every cell in the body needs thyroid hormone to be able to function. So we see widespread symptoms of something like low thyroid kind of affecting digestion, absorption, and all of that too. So we can look back at other things that could be causing them to not make enough stomach acid to begin with, while we help kind of support that process. Or if somebody does have like an H. pylori infection in their stomach, get rid of that, which can cause problems with their acid or ulcers. Even something like if somebody has ulcers, using aloe vera juice, can be actually really soothing to the gut lining. So there's different ways that we can use nutrients or different foods to help support that process. But it's always going back to the why question, like why is it happening in the first place?
Oh, that's so great. So, all right. So now we know there's food sensitivities that we want to get out of our diet. We know if there's too low stomach acid, that actually could be a problem that we didn't realize when we thought we had too much. And then the next step, so they get rid of the food. Is there any, now they still have this leaky gut. Do they need to do things to heal the leaky gut?
Yes, yeah, that's the big thing. Because if you don't heal the leaky gut and all you do is cut out the foods, that's when we see people come in and they're like, these are the 5 foods that I can tolerate now. And that's like all they're eating, because their list of what they can tolerate goes down and down and down when they don't fix the leaky gut, right? When they don't fix the reasons why it was happening in the first place. So you can heal leaky gut. It can take, depending on how bad it is, months, years. I know that when I first was having issues with my health, I did the elimination diet and I was working on my gut literally for years. I was just constantly helping support it because I was having so many food reactions and things that I couldn't eat then, like eggs, I can eat fine now. So it's like you can heal and reverse leaky gut, the damage. And it can take time, but we do a lot of stool testing in our practice too to figure out what's actually going on in the gut barrier. So we're not guessing either. We know what's wrong, how do we support it, look at how well they're digesting, absorbing, looking at the microbiome, all of those really important pieces to heal the gut for sure.
Oh, that's great. And that's good news. I mean, the good news for everybody listening is that am I right? There's just so much that can be done that you don't have to suffer. And it's just unfortunate. It's not something that everybody knows about. And
Right.
yeah, so they do those 3 things and they're good as new.
Yeah.
So why don't you tell us, you're doing an amazing, I'm so excited about your summit. Oh my gosh. You have such great speakers and you're doing it with one of my favorite people, Dr. Tom O'Brien, who's been on the podcast. And so tell everyone about the summit and what different areas that you're going to be talking about. And it's free. So it's really great.
Yeah, it's free. It's online. There's actually a whole week. It starts March 1st, goes to March 7th. So every day we have different speakers talking about different topics. We have people talking about some more like leaky gut, the gut autoimmune connection, the gut food sensitivity connection. We have people talking about what food sensitivities are, or the different types of reactions. How do we heal from them? And then we also have people just kind of talking about how do we make changes in our diet, right? Like how do we make changes or good habits that are maintainable? And it's that whole mental emotional component of like being able to heal the body as well. So we have people talking about all the different aspects of food and how it affects our body, how we can use it as medicine, how we can use it to heal, how we can identify the things that we shouldn't be eating, how do we, it's food sensitivity is an autoimmunity. So also just people that are having autoimmune conditions. I think everybody that eats would benefit from this summit just because everybody needs, to look at what they're doing on a regular basis. That's what's impacting our health directly. But yeah, I'm super excited. It's such an important topic. And we just get people asking all the time, like, well, what do I eat? And this summit really should help answer those questions that people have about food and how it's impacting us and how it can be like one of the most powerful tools out there that they can just start using, on their own.
This is great because this is what I see as well. People, simple little tweaks, they just don't realize, it's not, I mean, there have been people who've had arthritis for 20 years and they had no idea. Then they started doing the elimination and all of a sudden they're like, whoa, this feels better. Just not even realizing. So yeah, it's just incredibly important. So I'm very excited about this summit, and I made it easy for people. So it's tinyurl.com/food sensitivities summit. So, and I'll have it in the show notes, but it's just easy for people to go to if they're listening. And yeah, so that's great. Really exciting. So there's just so many things we can talk about, but is there anything else that you really want to share that you think is just important for the listeners to know about this?
Well, I think we kind of touched on it before, like symptoms are never normal. I think when people are kind of evaluating what's going on in their health, we get used to how we feel. So we feel normal having symptoms and we don't even recognize that that's happening anymore. But if you can just take like a little inventory of what's going on in your health overall, and you're like, yeah, I feel like I should have more energy, or I do get aches and pains, I do feel brain fogged, I can't remember where I put my keys, or I'm having some rashes and stuff. Those things are never normal. So I just want people to be like more aware of listening to their body, recognizing that that's their body's way of telling them that there's something wrong. And then knowing too that there's hope, you can actually reverse these conditions. Like you said, with arthritis, you see that go away all the time. All of these symptoms that people just kind of get used to and are dealing with, gone, just because we make simple changes or help them understand why their body's doing what it's doing and help support normal function again. So I think it's just important people get in tune with themselves. Don't settle with how you feel, because it's never normal to feel abnormal.
Oh, and one more thing. So if people want to get in touch with you, or what's the best way, you and explain your practice.
Yeah, we have an online virtual healthcare practice. We see people all over the world. We consult with them, partner with our patients to help kind of walk them through the process of what that looks like for them to get to where their health goals are. You can go to CaplanHealthInstitute.com. It's Caplan with a C, CAPLAN, healthinstitute.com. It's our website you can check out. We also offer a free 15-minute consultation with somebody on our clinical staff to see if you are a good fit for what we do in our practice. And we do online events all the time talking about different autoimmune or thyroid or different conditions that people are suffering with. So, but you can check out more at CaplanHealthInstitute.com.
Oh, great. Well, I can't thank you enough. And everybody listening, take step one, right? Start with the elimination that you can try yourself, but it might be hard. If it's hard, then work with someone, because it's not easy to know exactly. There's a lot more education needed to know where gluten is. But at least you can, that's certainly a start, and it's free. But your summit, so after they listen to the summit, they will have so much information.
Yes. Yeah. Oh, the summit it's all, I'm so excited. Like, we just got so many of these amazing experts that it's so, you get those light bulb moments just listening to them speak. It just makes so much sense, and that's super important for people, again, to understand the why behind what they need to do and how it's affecting them. So yeah, I'm super excited and definitely should check it out.
Great. And then the other thing is, right, when you see all these people that have been working with people that have all gotten better, it's just, you feel good, and you know what, there is another way. I don't have to live with this. So I think it's just such a wonderful thing. And thank you, because I know summits are not easy, and I can't imagine how much work you put in. And you said you have a young child, so
yeah, so that's my other job, my 9-month-old. Yeah.
So I know this wasn't an easy task, but you know what, you're going to benefit so many people. So thank you, and thank you so much for sharing all this great information with everybody. And I'm excited to attend the summit. So many great speakers. So thanks so much.
Thank you so much for having me.
I hope you've enjoyed my interview with Dr. Tiffany as much as I have, and now have a better understanding of food sensitivities and how this may be impacting your bones and overall health. Dr. Tiffany gave some really great places to start with the elimination diet. And there's even going to be a lot more information on this in the summit that she, her husband, and Dr. Tom O'Brien have put together in March. So it's very exciting to go look at the summit and learn more. Is just go to tinyurl.com/food sensitivities summit. But I'll have that link and the link to Dr. Tiffany's practice and information in the show notes. So bye for now, and I look forward to seeing you on the next episode.